Good morning, everyone. Our today's lecture is on protein energy malnutrition, part 1. In today's lecture, we are going to discuss about what is protein energy malnutrition. What do we mean by protein energy malnutrition? Now, we had heard this term number of times, undernutrition. First, we will discuss what is undernutrition. Before learning what is protein energy malnutrition, we will discuss about what is undernutrition. So basically undernutrition is a condition. Undernutrition it is a condition in which there is improper or inadequate consumption. Improper, insufficient, inadequate consumption, poor absorption, or there is excessive loss of the nutrients. So basically, what do we mean by undernutrition? Undernutrition, it is a condition in which there is poor absorption, extreme loss of the nutrients, and inadequate consumption. The consumption is not proper, the absorption is not proper, and with this, there is excessive loss of the nutrients. This is undernutrition. And what is overnutrition? Overnutrition is it is caused by excessive intake of the specific nutrients. When some particular nutrients or specific nutrients they are consumed in increased quantity. So excessive intake of specific nutrients or overindulgence is called overnutrition. Undernutrition was poor absorption, poor consumption, and excessive loss of the nutrients. And overnutrition is excessive intake of the specific nutrients. Now, the term malnutrition, it refers to both undernutrition as well as overnutrition. Now, sometimes the term malnutrition and protein energy malnutrition, they are used interchangeably. So we had discussed undernutrition, overnutrition, and the malnutrition refers to both undernutrition and overnutrition. Now, these malnourished children, we are talking about malnutrition, right? Malnutrition means both under and overnutrition. The term malnutrition means undernutrition as well as overnutrition. Now, these malnourished children, they suffer from excessive associated complications, and these malnourished children they are susceptible to infections, especially pneumonia, yeah, gastroenteritis or sepsis. The malnourished children they are more prone to other infections, other complications like sepsis, pneumonia, gastroenteritis. Then vitamin deficiencies and mineral deficiencies are also seen in malnourished children. Malnutrition in young children is determined through measurement of the height, weight, skin fold thickness, and the age. Now, till now we had discussed what is undernutrition, what is overnutrition, and the term malnutrition. And we have said that protein energy malnutrition and malnutrition, these both the terms are used interchangeably. Then the children who are malnourished, they suffer from variety of the complications. They are prone to deficiency of vitamins and minerals, and they are prone to develop infections like pneumonia, gastroenteritis, and sepsis. Now, in young children, malnutrition can be determined through measuring the height, weight, thickness of the skin fold, and the age. Now, how can we indicate undernutrition? What are the basic indicators of undernutrition? These indicators could be stunting, wasting, and underweight. Basically, the undernutrition, it is classified into three basic groups. Undernutrition is classified into three groups: undernourished or underweight, stunted and wasting means stunting, wasting and underweight. ये किसका क्लासिफिकेशन है? अंडर न्यूट्रिशन का. अंडर न्यूट्रिशन सिर्फ 3 कैटेगरीज में क्लासिफाइड है, स्टंटिंग, वेस्टिंग एंड अंडरवेट. Now the underweight. The underweight children, the underweight child or undernourished child has low weight for the age. Undernourished child has low weight for age. Now stunting. Stunting means short. Stunting. The word stunting means short or low height. So stunting means short or low height for age. Underweight was, the term itself signifies underweight means low weight for the age. The weight is less according to the age. So underweight. Then stunting means stunted growth. हम कहते हैं ना stunted growth means low height, short height. So low height according to the age. So low height for age. Then wasting. Now wasting means low weight for height. Low weight for height. And the child who has wasting, he has a particular emaciated look. So these are the classification of the undernutrition. There are 3 basic indicators of undernutrition, and these are stunting, wasting and underweight. Stunting means low height for age, wasting means low weight for height, and underweight is low weight for the age. Now these are the indicators of malnutrition. Now, so this was the introduction of protein energy malnutrition. Now we will discuss what is protein energy malnutrition. So basically protein energy malnutrition, it's a main health problem in our country, and the affected child has permanent impairment in his later life. So severe acute malnutrition among children 6 to 59 months of the age. It is defined by WHO as any one of the following. Is any of the following. So UNICEF and WHO, they have defined severe acute malnutrition as any of these following points. First is weight for height below -3 standard deviation of the median WHO growth reference. Then visible severe wasting. Then presence of bipedal edema. And fourth is mid upper arm circumference below 11.5 centimeter. So these are defined by WHO and UNICEF. And also according to World Health Organization, that is WHO, protein energy malnutrition, it refers to a imbalance. It refers to imbalance between the supply of the protein and energy and the demand of the body for them to ensure optimal growth and function. And this protein energy malnutrition, it especially affects the preschoolers, that is children below 6 years of the age. And it has a direct consequences ranging from physical to cognitive growth and increased susceptibility to other infections. And this can lead to permanent impairment in the child's later life. So basically WHO has defined protein energy malnutrition as an imbalance between the supply of the protein and energy, imbalance between the supply of the proteins and energy and the demand of the body to ensure optimal growth and function. It especially affects children below 6 years of the age. And PEM, it also increases the risk of other infections. It leads to complications or consequences ranging from physical to cognitive growth, and also leads to permanent impairment in the child's later life. And this WHO and UNICEF, they have defined malnutrition as any of the following: weight for height less than -3 standard deviations, visible severe wasting, then presence of bipedal edema, and mid upper arm circumference less than 11.5 centimeter. Now these 4 points, this classification, it is used to identify children who are at risk for death. Children having severe acute malnutrition require urgent attention and management in the hospital. But there is a point: in children below 6 months of the age, MUAC, that is mid upper arm circumference, it cannot be used, and SAM should be diagnosed in the presence of the other 3 points, that is weight for height below 3 standard deviations, visible severe wasting, and presence of bipedal edema. Only these 3 points will be required to diagnose SAM in children below 6 months of the age, and mid upper arm circumference, it won't be used for diagnosing malnutrition in children below 6 months of the age. Actually, the assessment of the nutritional status is done according to the weight for height, height for age, and presence of the edema. The nutritional status का जब assessment करते हैं, it is done according to weight for the height, height for the age, and presence of the edema. But WHO has recommended the use of Z-score or standard deviation score for evaluating the data. Basically, there's a formula of the SD score, that is, it's a formula having SD score is equal to observed value minus median reference value upon standard deviation of the reference population. That's a formula. But basically, WHO has recommended SD score for evaluating the anthropometric data. Now the etiology. Etiology of severe acute malnutrition. The causes of malnutrition could be viewed as immediate, underlying, and basic. Now, the immediate determinants. The immediate determinants of the child nutritional status, they work at the individual level, and they include low birth weight, any illness, any infection, diarrhea, pneumonia, and improper dietary intake. So, immediate determinants. This is the etiology of the malnutrition. So, immediate determinants. And these immediate determinants, they obviously they work on the individual level. They work at the individual level, and they would include low birth weight, any kind of disease, any infection, pneumonia, diarrhea, and improper dietary intake. Then underlying determinants. Next is underlying determinants. Now, the immediate determinants, they are in turn influenced by 3 household determinants, that is food, health, and the care. Immediate determinants, they work at the individual level, and they were the low birth weight, diarrhea, pneumonia, infections, and improper dietary intake. Underlying determinants, now the immediate determinants, they are influenced by the underlying determinants, that is food, health, and the care. Now food, what do we mean by food? How could food determine? So food, it means food refers to food security of the food at the household level. It is the access to have safe food, both in quantity and the quality. Means the quantity and the quality of the food should be good enough, it should be safe enough, and it should be focused on the energy which is provided by the food. So focus on energy, proteins, and the micronutrients. Now all this, it depends upon having financial access, social access, and physical access apart from only availability. So first determinant is food. So food means security of the food at the household level, both in quantity and the quality. The food should be safe both in quantity and quality, and that should focus attention on, that should put attention on the energy provided by the food, protein content, micronutrients, and all this in turn depends upon the having financial access, social access apart from your availability. Then care. Now care means, care, it is a process. Care. The word care means it's a process which takes place between the caregiver and the receiver of the care. It's a process, care, it's a process which takes place between two people. The one who is giving the care and the one who is receiving the care. So process between caregiver and the care receiver. In this, it translates the availability of the food and presence of health services into growth and development of the child. Care, process between the receiver and the giver. So it would translate, it would convert the availability of the food and the availability of the health services into growth and development of the child. In many households, they have abundance of food, but still they have malnourished children due to absence of the care. If the parents are not taking care, they are not taking attention to the health of the child. So in such families, though there is abundance of food, but still they have malnourished children due to absence of the care. So care is very important. So many households, they have abundance of food but still have malnourished children due to absence of the care. Care includes care for the women, breastfeeding, complementary feeding, health services, home services, hygienic practices, then psychosocial care, food preparation care, then health. Health means, it means access to curative and preventive health services to all the community members, as well as the hygienic environment, sanitary environment, and access to purified water. So health means everybody should have access to preventive health services, curative health services, and all the members in the community, they should have hygienic environment, sanitary environment, and they should have access to purified, clean, hygienic water. And the last is basic determinants. First was immediate determinants. Second was underlying determinants, in which there were food, health, and the care. And the third is basic determinants. Now, finally, the underlying determinants, they are influenced by the basic determinants. And these basic determinants include socioeconomic status and educational level of the families, socioeconomic status of the family members, education level of the mother, of the father, of the family, then women's empowerment, cultural taboos, cultural customs. Taboos means particular customs of particular religion. So cultural taboos regarding consumption of particular food, and health access to water and sanitation, purified access to health services, purified water and sanitary environment. So these are the basic determinants. Thank you. So till now we had discussed protein, energy malnutrition, and etiology. Thank you.